Thanks, Sam. Well, one of the troubling parts of COVID is that people have been putting off procedures and checkups, and heart issues can be ignored. Here to talk about the heart conditions that cannot be ignored is Nicole Gallant, an APRN at Hartford Healthcare's Heart and Vascular Institute. Nicole, welcome.
Hi, thank you for having me, Lisa.
Thanks for being here. So what exactly is congestive heart failure?
Well, basically, congestive heart failure is the heart's inability to meet the demands of the body. The left ventricle, or the base chamber of the heart, loses its ability to either contract, which is to pump, or to relax, normally due to some type of damage. When the heart can't pump blood out to the rest of the body, we call this systolic heart failure. And in diastolic heart failure, the chamber has become smaller because the wall gets thick and stiff, and that it's unable to have adequate blood in and out between contractions. So despite the type of heart failure or the cause, when the blood can't leave the heart normally, pressures begin to build up and blood backs up into the lungs, and this is what causes the congestion.
Okay. What are some of the symptoms and who's at risk?
Well, really there are several causes to heart failure, so we're all at risk, but there are some things that predispose patients and put them at higher risk. One of them being coronary artery disease, which is plaque buildup in the heart arteries. This is the #1 cause of heart failure, so if a patient has that history, that puts them at greater risk. High blood pressure or hypertension, family history, and valvular disorders, so the valves that sit between the chambers in the heart. Some of the most common symptoms patients present and verbalize are shortness of breath or breathlessness, so they can't catch their breath. They have weight gain but decreased appetite. They have swelling of the body parts, the legs, hands, feet, abdomen, and they really have this overall decreased activity level. They used to be able to walk around the block, but now they really can't only go to the mailbox and back without having to rest.
All right, what are some of the treatment options available at the Heart and Vascular Institute?
Well, here at the Heart and Vascular Institute, we're really on the cutting edge of technology. We have several nationally recognized programs for managing patients with heart failure. CardioMEMS is one of the newest devices that, especially during COVID, at this time, we're able to manage patients from home. The device is a small sensor that sits in the pulmonary artery and allows patients to transmit pressures to their doctors on a daily basis, which allows the doctors to adjust their medications before congestion occurs. The other specialties within the Institute help manage patients with amyloidosis, inherited or genetic cardiomyopathy, pulmonary hypertension, outpatient IV infusion therapy, LVADs, heart transplants. And really the benefit to this is that these treatments are not just available here at Hartford Hospital, but we have expanded throughout Hartford Healthcare and now should be available to patients in their local communities.
All right, tell me about your upcoming webinar on this topic.
Yeah, so tomorrow I'll be hosting an online webinar, and I'll talk more about congestive heart failure for patients, some of the treatment options and symptoms they may experience. They can register by going to hartfordhealthcare.org virtual classes, or they can call 855-HCC here to register.
All right, Nicole Gallant with Hartford Healthcare's Heart and Vascular Institute. Thank you for joining us.
Thank you for having me.